Arlington County began the month of May with another virtual town hall. There were a large number of special guests. Participants included County Board members Katie Crystal and Matt DiFerrante, as well as Deputy County Manager Jim Schwartz, Police Chief Jay Farr, Fire Department Chief David Povlitz, Lissa Friedman from Child Protective Services, and Candice Lopez from Project Peace. The meeting started promptly at 12 noon with opening remarks by Matt DiFerrante, acknowledging that Arlington County has passed the 1,000 mark for confirmed COVID-19 cases. A new dashboard has been set up with data from the Virginia Department of Health to help users monitor the status of the disease. Testing has been expanded to include 2 drive-up sites with a plan for a 3rd testing site for walk-up patients. As before, testing availability is limited to symptomatic patients with physician authorization, and an advance appointment is still required. Mr. DiFerrante encouraged residents to wear cloth face coverings or masks, wash their hands frequently, continue to practice social distancing, and to be especially careful when shopping for groceries. Mr. DiFerrante spoke of crushing the curve, although his meaning was unclear. The county has reached out with food and housing assistance, providing renters and landlords with information, but, as we have observed before, there was no mention of any landlord granting rent reduction or forgiveness. Don Hammond's Arlington Weekly News observes and identifies an odd phenomenon of our times that, while many individuals and businesses are called upon to make sacrifices, especially economic sacrifices, the landowners are still expecting to be paid in full. Mr. DiFerrante ceded the floor to Katie Crystal, who went over some of the Virginia governor's criteria for reopening the state. These included 14-day downward trends in cases and hospitalizations, and Ms. Crystal acknowledged that Arlington was nowhere near that position. However, she reported that hospital capacity and supplies of personal protective equipment were adequate at this time. Police Chief Jay Farr took over and stated that his department's main goal was to assure compliance with the executive order from the governor. He went on to state that the biggest compliance challenge revolved around the closed public parks, with lesser challenges from a few local businesses. He was pleased to report that, as yet, no formal citations had been issued, but reiterated the message that, as much as possible, everyone should stay home. Next to report was Fire Chief David Povlitz. He said that the number of emergency calls had declined, but that the patients involved were sicker, requiring greater care. He wanted to make the public aware of a triage phone line where concerned residents could call for preliminary help for manageable symptoms, and then, for moderate cases, a visiting service to determine the extent of the illness, and finally, if necessary, transport to a medical facility. Mr. Povlitz went on to state that his crew was receiving daily health screenings to assure that they were at least asymptomatic and had adequate supplies of personal protective equipment. Katie Crystal then turned the topic to domestic violence and child abuse, calling on Candice Lopez of Project Peace for comments. Ms. Lopez reported that her organization was still considered an essential service and that a 24/7 hotline was still available. She provided the number for the hotline: 703-237-0881. Lissa Friedman of Child Protective Services noted that the volume of calls had declined slightly, but that it was expected to increase as the strain of staying at home increased over time. She provided another phone-in hotline number: 703-228-1500. In addition, she mentioned continuing outreach to help people manage stress and a virtual education website. The meeting was then opened up for viewer questions. A question about fraud was taken by Police Chief Farr, who said that the main danger was from online solicitations or scammers. He advised residents never to give account numbers or personal data over the phone. Another question was about personal protective equipment for the police, and Chief Farr replied that a large supply of cloth masks had just been received. Jim Schwartz fielded the next question, which was about testing. In addition to mentioning a planned walk-up site with a May 11th goal for opening, he said that persons without insurance or a regular physician could get help via the free clinic or one of the urgent care facilities in the area. He also acknowledged that there was not enough testing capacity yet to meet the governor's criteria for reopening normal activities. Katie Crystal fielded some questions about tracking and reporting COVID infections by race and/or geography. The data is gathered and reported on a state level by the Virginia Department of Health, and even so, much of the data is inadequate due to early tests not requesting identification by race or location. Fire Chief Povlitz then mentioned their own precautions at the fire department, that they had adequate supplies, and then he mentioned that they observed a 10-foot distance within their facilities. Other topics included taxes. Property tax billings will continue as usual, but payment extensions are possible. Home cleaning services are considered essential in the common areas of multifamily buildings, but are not encouraged for owners of detached houses unless deemed necessary for the health of the occupant. Meanwhile, contact tracing for asymptomatic residents is being pursued by Dr. Varghese' staff as well as some 170 members of the Medical Reserve Corps. As for facility-based reporting of COVID cases within nursing homes, that is controlled on the state level, so details are not available. Katie Crystal introduced a citizen question about opening certain major streets for pedestrian-only traffic, as is sometimes done for day-long festivals. Police Chief Farr replied that a day-long festival is very different from an extended street closure due to the resources required to assure safety. Another consideration is those who would be impacted from such a long-term closure: residents, businesses, deliveries, to name a few. At this time, there are not adequate resources for most of the proposed large-scale closures. Another question came in about how to obtain masks. A few solutions were offered. A help hotline at 703-228-7999, asking neighbors who had masks, and finally, an online video from Libby Garvey showing how to make a homemade mask. More questions about reopening received the same answer. It will be based on meeting the criteria set forth by the governor, and Arlington is not yet able to comply. Another question seemed almost rhetorical. How can we be sure that resources from Project Peace and Child Protective Services are reaching those in need? Lissa Friedman and Candice Lopez could only reply that they were trying, with the use of handouts, flyers, social media, teacher contacts, as well as state resources. Police Chief Farr also mentioned that his department was also a partner in that effort. The last questions involved county employees, testing, and volunteers. Arlington Cares was given as a resource. In closing remarks, it was acknowledged that the county had just passed the budget for fiscal year 2021, that the county was trying to avoid furloughs, that reopening could not be expected until at least the end of May, and that anyone seeking more information could go to the county website at www.arlingtonva.us/coronavirus. The meeting ended, at 1:02 p.m.